Recent discoveries in cardiac vagal pathways, implications for heart function and arrhythmias. 1. Introduction. The autonomic nervous system orchestrates the fine-tuned regulation of cardiovascular functions, a process vital for maintaining physiological equilibrium and adapting to the body's dynamic needs. Point 1. Within this intricate network, the vagus nerve, the principal conduit of the parasympathetic branch, has long been acknowledged for its significant influence over the heart. Point 3. The classical understanding of vagal control primarily involves the modulation of heart rate and contractility through the release of acetylcholine at the sinoatrial and atrioventricular nodes, effectively acting as a physiological brake on the heart. Point 1. However, contemporary scientific investigations are revealing a more intricate and nuanced architecture of vagal cardiac innervation, hinting at the existence of distinct and specialized pathways that extend beyond this traditional view. Point 7. These emerging findings challenge the notion of the vagus nerve as a monolithic regulator of cardiac activity and suggest a more sophisticated and region-specific control mechanism. This report aims to explore these recently discovered cardiac pathways within the vagus nerve, providing a comprehensive analysis of their anatomical characteristics, their mechanisms of action in governing heart function, and their involvement in the complex dynamics of cardiac arrhythmias. Furthermore, this analysis will delve into the concept of neurovascular conflict affecting the delicate vagal nervelets originating from the brainstem and its potential ramifications for cardiac behavior. The traditional model of vagal influence on the heart, largely centered on the modulation of heart rate via the sinoatrial and atrioventricular nodes, appears insufficient to fully account for the diverse spectrum of cardiac effects observed in recent studies. The growing body of evidence supporting the existence of specialized pathways implies a more refined and targeted control system than previously appreciated. This necessitates a thorough reevaluation of the established models of cardiac autonomic regulation to incorporate these novel findings. 2. Unveiling the novel cardiac pathways within the vagus nerve. While foundational anatomical studies have provided a general understanding of the vagus nerve's trajectory and its primary branches innervating the heart, the precise details of specific cardiac pathways and their intended targets have remained largely uncharted territory until recent advancements. Contemporary research, leveraging sophisticated neuroanatomical methodologies, has begun to illuminate the existence of distinct cardiac vagal pathways exhibiting unique innervation patterns. A pivotal study 8, employing a lipophilic nerve tracer dye (DIO), meticulously mapped the anatomical innervation of the left cardiac vagal branch in a large animal model. This investigation revealed that the left cardiac vagal branch extends its influence to major regulatory ganglionic plexi, including the right atrial ganglionic plexi and the ganglionic plexi innervating the left ventricle, such as the posterolateral left atrial ganglionic plexi and the fat pads surrounding the left coronary artery. Point 8. Notably, functional stimulation of this specific left cardiac vagal branch under anesthesia resulted in a reduction in heart rate, confirming its connection to the sinoatrial node. Moreover, when the heart rate was artificially maintained through pacing, stimulation of this same branch led to an increase in coronary artery blood flow. Point 8. This observation stands in contrast to the classical understanding that the right vagus nerve primarily innervates the sinoatrial node, while the left vagus nerve predominantly targets the atrioventricular node. Point 1. The discovery of a left vagal branch influencing both heart rate and coronary blood flow suggests a more integrated and potentially specialized role for different components of the vagal innervation. Although the precise anatomical mapping of all newly discovered cardiac vagal pathways in humans is an ongoing endeavor, these studies in animal models offer compelling evidence for a more complex and regionally specific vagal innervation of the heart. The identification of specific cardiac vagal branches, such as the left cardiac vagal branch with its multifaceted innervation of atrial and ventricular ganglia and its influence on both heart rate and coronary blood flow, signifies a departure from the simplistic right sinoatrial node and left atrioventricular node model. This suggests the potential for highly targeted autonomic interventions that could modulate specific aspects of cardiac function with greater precision. Furthermore, ongoing research is dedicated to identifying specific molecular markers and genetic signatures that characterize these distinct cardiac vagal pathways. Point 9. While study focused on vagal sensory neurons expressing the neuropeptide Y receptor Y2 and their role in the basal Yarish reflex and fainting 9, it underscores the potential for genetically defined subpopulations of vagal neurons with specialized functional roles in cardiac regulation. Similarly, the active pursuit of molecular markers specific to cardiac vagal afferent neurons 10 suggests that analogous markers might exist for efferent pathways as well, further refining our understanding of these novel pathways. The recently discovered cardiac vagal pathways exert their control over heart function through a combination of well-established and potentially novel mechanisms. While the release of acetylcholine and the activation of muscarinic receptors remain fundamental to vagal effects on the heart. 11, contemporary research indicates the involvement of other signaling molecules and intracellular pathways that contribute to a more nuanced regulation. The study highlighting the left cardiac vagal branch 8 revealed that the dynamic modulation of coronary artery blood flow during exercise, mediated by this branch, involves the co-transmitter neuropeptide vasoactive intestinal peptide (VIP), rather than solely relying on acetylcholine. This suggests that specific vagal pathways might employ different neurotransmitters to achieve distinct cardiac effects, particularly in response to varying physiological demands, such as increased metabolic demand during exercise. Point 8. Myocardium to selective stimulation of vagal efferent activity. Point 14. These studies demonstrated that vagal stimulation induces significant transcriptional changes within the heart, affecting pathways that govern autonomic signaling, inflammation, fibrosis, and hypertrophy. Specifically, Chiagan Ingenuity Pathway Analysis (IPA) identified numerous canonical pathways that are significantly modulated by vagal activity, including those related to protein synthesis, autophagy, integrin signaling, and NFA2-regulated cardiac hypertrophy. Point 14. Notably, these studies also predicted that the identified differentially expressed genes are targets of various upstream regulators, including transcription factors such as MYC and NRF1, and microRNAs such as miR-335-3P and miR-338-3P. Point 14. These findings underscore the profound and rapid impact of vagal activity on myocardial gene expression, extending beyond the immediate electrophysiological effects and suggesting a potential role in long-term cardiac remodeling and adaptation to various physiological states. The involvement of VIP in mediating coronary blood flow under vagal control, alongside the significant transcriptional changes in the myocardium induced by vagal stimulation, suggests that the newly discovered pathways contribute to cardiac regulation through a broader range of mechanisms than previously appreciated. This includes not only rapid neurotransmission but also slower genomic effects that can influence cardiac structure and function over extended periods. The interplay between vagal activity and nitric oxide (NO) signaling also appears to be an important mechanism in cardiac regulation. Point 12. Vagal nerve stimulation has been shown to modulate the expression of different nitric oxide synthase (NOS) isoforms in the heart, which play critical roles in various physiological and pathophysiological processes, including cell growth, apoptosis, myocardial relaxation, and coronary perfusion. This intricate network of signaling pathways highlights the complexity of vagal control and the potential for these newly discovered pathways to contribute to a more finely tuned and context-dependent regulation of cardiac function, including adapting to physiological demands such as exercise, where cardiac vagal nerve activity actually increases and is crucial for maintaining cardiac function. Point 8. The intricate and regionally specific control exerted by the newly discovered cardiac vagal pathways has significant implications for understanding the complex dynamics of cardiac arrhythmias. While vagal activity is generally considered to have an antiarrhythmic influence, its precise role in the initiation, maintenance, and termination of various arrhythmias is complex and depends heavily on the specific context. Point 2. Vagal nerve stimulation, VNS, has emerged as a potential therapeutic approach for treating arrhythmias, primarily due to its antiadrenergic and anti-inflammatory effects. 17. However, the outcomes of clinical trials employing VNS have been inconsistent, possibly stemming from an incomplete understanding of the optimal stimulation parameters required to selectively target the relevant cardiovascular diseases and pathways. 17. Atrial fibrillation, AF, the most prevalent cardiac arrhythmia, has been extensively investigated in relation to vagal activity. 11. While strong vagal stimulation can paradoxically induce or perpetuate AF in certain instances, likely due to the heterogeneous distribution of vagal innervation within the atria, low-level VNS, particularly transcutaneous stimulation of the auricular branch of the vagus nerve, LLTS, has demonstrated promise in suppressing AF. 17. The concept of vagally mediated paroxysmal atrial fibrillation, PAF, underscores the role of heightened vagal tone in triggering episodes of AF, often characterized by specific temporal patterns, such as occurrence during sleep or after meals, and distinct electrophysiological features. 22. Furthermore, vagal nerve stimulation has shown potential in the management of ventricular arrhythmias, VAs, which are frequently triggered by elevated sympathetic tone or diminished vagal tone. 17. VNS is believed to exert beneficial effects on VAs by directly mitigating sympathetic activity, indirectly inhibiting myocardial remodeling and inflammation, and enhancing ventricular electrical stability. 17. Animal studies have indicated that chronic VNS can reduce the inducibility of ventricular tachycardias and offer protection against VAs during acute ischemic events and the subsequent reperfusion phase. 17. The newly discovered specific cardiac vagal pathways may have distinct roles in modulating the risk and characteristics of various arrhythmias. For example, pathways preferentially innervating the atria might be more critically involved in the initiation and maintenance of atrial fibrillation, while those targeting the ventricles could be more relevant to the occurrence and dynamics of ventricular arrhythmias. Understanding these pathway-specific roles could pave the way for the development of more targeted and effective neuromodulation therapies for different types of heart rhythm disorders. Additionally, dysfunction in certain vagal pathways could potentially lead to bradyarrhythmias or conduction blocks due to an excessive parasympathetic influence on the sinoatrial or atrioventricular nodes. 29. Clinical case reports have documented instances of vagally mediated atrioventricular blocks, where targeted ablation of endocardial vagal innervation sites has been shown to effectively reduce the frequency and duration of problematic ventricular pauses. 30. Neurovascular conflict, NVC, describes the phenomenon of a cranial nerve being compressed or coming into contact with a nearby blood vessel at the point where the nerve exits the brainstem. 32. While this is a well-established cause of conditions like trigeminal neuralgia and hemifacial spasm, recent attention has turned to the potential for NVC to affect the vagus nerve as well. 32. The vagus nerve originates bilaterally from the medulla oblongata as a collection of fine nerve filaments that subsequently merge to form a single trunk. 1. As these delicate nervelets emerge from the brainstem, they're situated in close proximity to various arteries and veins, rendering them potentially susceptible to compression, particularly in the presence of anatomical variations or age-related changes in the vasculature. NVC affecting the vagal nervelets can disrupt the normal transmission of neural signals, potentially giving rise to a diverse array of symptoms depending on which specific nerve fibers are impacted. 3. Given the vagus nerve's extensive innervation of the heart, it is plausible that NVC at the brainstem can have a significant impact on cardiac behavior. Symptoms suggestive of vagal nerve dysfunction, potentially stemming from NVC, include the onset of anxiety, tachycardia, bloating, nausea, and even episodes of syncope, such as vasovagal syncope. 4. In vasovagal syncope, an exaggerated response of the vagus nerve to certain triggers can lead to a sudden and pronounced decrease in both heart rate and blood pressure, ultimately resulting in fainting. 4. Neurovascular conflict at the brainstem could selectively impact specific afferent vagal nervelets responsible for innervating different regions of the heart or mediating distinct cardiac functions, such as heart rate control versus the regulation of coronary blood flow. This selective disruption could lead to a wide spectrum of cardiac manifestations, often making accurate diagnosis a considerable challenge. While magnetic resonance imaging, MRI, can aid in visualizing potential vascular compression of the vagus nerve at the brainstem, the mere presence of a blood vessel in close proximity to the nerve does not invariably indicate a symptomatic conflict. 32. A thorough clinical evaluation, coupled with the exclusion of other potential underlying causes, remains essential for establishing a diagnosis of vagal NVC as the source of cardiac symptoms. Research dedicated to precisely mapping specific sections or branches of the vagal nervelets to particular cardiac behaviors is still in its nascent stages. However, some valuable insights can be derived from existing anatomical and functional studies. 1. As previously discussed, the right and left vagal nerves exhibit a general preference for innervating the sinoatrial and atrioventricular nodes, respectively. 1. Consequently, compression of the right vagal nerve or its cardiac branches closer to the brainstem might exert a more pronounced effect on heart rate regulation, potentially leading to bradycardia or delays in atrioventricular conduction. Conversely, compression of the left vagal nerve might primarily influence atrioventricular nodal function. The discovery of the left cardiac vagal branch and its innervation of both atrial and ventricular ganglia, as well as its role in regulating coronary blood flow rate, suggests that compression of this specific branch could result in a combination of effects, including a reduction in heart rate and alterations in coronary perfusion. Furthermore, the vagus nerve establishes interactions with the sympathetic nervous system at various levels, including the cervical ganglia. 6. Compression affecting the vagus nerve in the cervical region, where these interactions occur, could disrupt the delicate balance between sympathetic and parasympathetic tone, potentially predisposing individuals to various cardiac rhythm disturbances or irregularities in blood pressure. While a precise one-to-one mapping of specific vagal nervelet sections to singular cardiac behaviors is likely an oversimplification given the intricate and interconnected nature of autonomic control, understanding the general anatomical distribution and functional specializations of different vagal branches provides a crucial framework for predicting the potential cardiac consequences of compression at different anatomical locations. The role of the nodose ganglion, which houses afferent fibers, also warrants consideration. Compression of this ganglion could impair sensory feedback from the heart to the brainstem, indirectly influencing afferent vagal output and consequently affecting cardiac function. 6. The concept of cervicovagopathy 6 suggests that compression of the vagus nerve in the cervical region, often stemming from structural issues within the neck, can lead to a variety of cardiovascular symptoms, including tachycardia, postural orthostatic tachycardia syndrome, POTS, like symptoms, and potentially cardiac arrhythmias. The specific location and nature of the compression within the neck might influence the particular type of cardiac manifestation observed. The clinical presentation of cardiac dysfunction resulting from neurovascular conflict is likely influenced by the chronicity and severity of the compression, as well as individual anatomical variations in the positioning of nerves and blood vessels. Advanced imaging techniques, combined with detailed electrophysiological studies, are essential to further elucidate these complex correlations. Specializations of different vagal branches provide a foundational framework for understanding the potential cardiac consequences of compression at various anatomical locations. Future research endeavors should prioritize further elucidating the anatomical and functional characteristics of these newly discovered cardiac vagal pathways in human subjects, rigorously investigating the specific molecular mechanisms that underlie their control of heart function, and developing more sophisticated diagnostic tools for accurately identifying and characterizing neurovascular conflict of the vagus nerve. Ultimately, a more comprehensive understanding of these complex interactions will pave the way for the development of more targeted and effective therapeutic interventions for a wide spectrum of cardiovascular conditions that are related to autonomic dysfunction. Table 1. Summary of newly discovered cardiac vagal pathways and their potential functions. Pathway name anatomical location / targets primary neurotransmitters / C nailing molecules potential effects on heart function left cardiac vagal branch right atrial ganglionic plexi RAGP posterolateral left atrial ganglionic plexi plaque left coronary artery fat patacetylcholine vasoactive intestinal peptide VIP heart rate reduction increased coronary artery blood flow genetically